Acute stress disorder. What is acute stress disorder? Acute stress disorder, ASD, was added to the DSM-4 in 1995 to distinguish individuals who experienced similar symptoms of post-traumatic stress disorder, PTSD, but do not meet the criteria of PTSD. ASD typically occurs after exposure to a traumatic event and involves symptoms such as intrusion, negative mood, dissociation, avoidance, or arousal, and lasts a minimum of 3 days. What is a traumatic event? Examples include war, rape or sexual violence, physical attack, mugging, childhood physical or sexual violence, kidnapping, hostage situation, terrorist attack, torture, natural disaster. The American Psychiatric Association describes acute stress disorder as exposure to actual or threatened death, serious injury, or sexual violation in one or more of the following ways: directly experiencing the traumatic event, witnessing in person the events as it happens to others, learning of the traumatic events which occurred to close family or friend, experiencing repeated or extreme exposure to adverse details of traumatic events. Who is at risk? Trauma can occur at any age. Men are more often exposed to trauma. However, the types of trauma differ greatly based on gender. Men are more often exposed to combat and physical violence, whereas women are more likely to be exposed to sexual assault and rape. African American, American Indian, and Native Alaskans have the highest rate of exposure to traumatic events. What are the symptoms? Negative mood, persistent inability to experience positive emotions such as happiness, satisfactions, or feelings of love. Dissociation, having an altered sense of reality, such as seeing oneself from an outside perspective or being in a daze, may also have difficulty recalling details of the traumatic event. Avoidance, occurs by intentional efforts to avoid distressing memories, thoughts, and feelings which are associated with the event. Arousal, sleep disturbances, irritable behavior, or angry outbursts, including verbal or physical aggression, may also include hypervigilance, difficulty concentrating, and an exaggerated startle response. Intrusion, recurrent involuntary distressing memories of the traumatic event, which may include dreams or flashbacks. How do I get help? Cognitive behavior therapies have had great success in treating acute stress disorder. CBT targets the distorted threat appraisal process to desensitize the patient to triggers related to the trauma. Psychopharmacology has been found to be effective in the management of symptoms associated with ASD, with SSRIs being the current medication of choice. Psychodynamic psychotherapy is effective when treating teens. In this approach, painful feelings and memories of the trauma are combined with exploring the connections of current and past experiences and relationships.